Good afternoon, everybody. My name is Scott McGann from the Falmouth Health Department. Today is March 18th, 2022, doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Luckily, I have not got a COVID email for a while, but it's there if you need to call us, talk to us. And our phone number is 508-495-7485. So as of yesterday's case count, 4,095 PCRs. Remember, it's PCR. Only 14 confirmed PCRs and 2 probables, which are not the rapid tests. These would be probables that are done at places like Convenient MD. Our 14-day incidence rate per 100,000 dropped to 6.6 from 8.2. What 6.6 means, we were averaged 28 cases in 14 days, or 2 per day. So that's what we've been averaging for confirmed. Has been 2 per day, which gives us a population of 100,000 and incidence rate of 6.6. And our 14-day positivity is 2.23, and it used to be, last week it was 2.86. This is the weekly case count of PCR tests. You can see there's been 3, 4, 5 weeks where it's been under 50. The last 3 weeks have been very similar, 15, 14, and 14. Again, I do not know the total number of cases because home tests are probably slightly outpacing. The number of, so I'd say we averaged, they do things in a 2-week span, so 2,800 to 3,000, which would be between 14 and 1,500 weekly tests were probably our average before home tests. Now it's somewhere around 1,000 tests, 800 tests. So, for 2 weeks, instead of being 2,800, it's 1,700 PCR tests. So we're still cranking out a fair amount PCR tests, and so our positivity obviously is low, so it tells you, that's the good indicator, because I would assume that home tests are probably similar. But as far as total case counts, with the drop in PCR, the 14 is not really the actual number. The number is going to be something higher, probably maybe twice or something like that. So, but that's what we are averaging. It's not gone by any stretch. There's a new cousin of Omicron out there, which accounts for somewhere around, I heard today, just doing some searches, I don't have a slide, a bit more than a quarter of the cases, but it doesn't seem to be showing up as this big spike like Omicron, the original version did, partly because they don't have a lot of data. Maybe the vaccine's slightly better, maybe not, but a lot of people got Omicron, so it doesn't have as many places to go because people were recently infected with the original Omicron. It's not really having any indication of a sharp increase or anything at that point, at this point in time. As again, PCR, this is our flattening the curve chart. Basically, the flatter and more densely packed the circles are, the better we're doing. You can see that our trend shows more of the far right, that we're back into a good pattern of lower case counts, that horrible case counts that we were having in January. This is the county, similar thing. The spike in January, they had, their average 3-day averages, much, much lower in the teens, 20s, somewhere in there for 3 days. So that's good. The state's 899 for, I think the day before was in the 5-something range. So it's under 1,000 cases per day PCR. They've readjusted deaths. You'll see the death numbers be lower. They readjusted the definition of a COVID death. I think it was a death with a COVID on a death certificate if COVID was within 60 days, and they have changed it to 30 days, so that lowered the death rate, the death count in Massachusetts by redefining what a death was considered. The positivity for the state in that 7-day period was 1.59, so that's quite good. You definitely like to be under 2 preferably %, and we are. Our incidence rate, again, 6.6. 1, 2, 3, 4, 5, 6, 7, 8, 9 towns are higher. The rest are lower, or roughly the same. So we're similar to what would make Mashpee right now. Bourne's a little lower. Where you got to sort of Yarmouth and Barnstable's closer to 10 as an incidence rate. Positivity. Positivity is, again, middle of the pack. This is 1, 2, 3, 4, 5, 6 or 7 or so towns that are higher. The state for that particular time frame would be 1.6, so we're still testing a little bit higher for a % positivity. Now, what's going to determine whether we're a low risk? Most of the country, including the Barnstable County, is in the low. What they're using is, if they adjust the population per 100,000 Fewer than 200 cases can be either low, medium, or high. Right now, Barnstable County is in the low green category. They also look at new admissions per 100,000, less than 10 new admissions per 100,000 over 7 days, and a percentage of staff inpatient beds occupied by COVID-19 patients over 7 days of less than 10%. So what does that mean? And so I was looking at the CDC website today, and what that means, and again, if you're low risk, you wear a mask based on personal preference, that's where we're at. Medium, if you have contact with people at high risk, you want to consider it. And high, then we need to start talking about things like schools and things like that, needing a mask mandate requirement. Looking at the CDC, that the number of less than, go back up here, fewer than 200 per 100,000. The case rate per 100,000 of the 7 days was 53.52. Okay. Our cases dropped 11.63%, a positivity by 0.13, and new admissions confirmed new admissions of confirmed COVID-19 among county residents estimated was down 12.3. So that number is 53.52, which is far less than 200. And the other numbers, new admissions of confirmed COVID-19 per 100,000 population last 7 days was 3.7. And that is much lower than 10. Okay, so I went back to that slide. And percentage of staff inpatient beds used by patients with confirmed COVID, 1.1%, and that's less than 10%. So that's why we're in the low category. So I'm using the CDC because the state really hasn't given us anything on this, so we'll just go with this for now. And so that's where the data I got from data was through March 15th, and that's on the CDC website. So that's where we are with the cases. We're in pretty good shape. Again, confirmed numbers are what they are with home tests, which aren't going to show up on there. But using those other metrics, hospitalizations is going to be obviously a known number. So that's where we can look at those numbers, and those should be fairly accurate, much more so than compared to, let's say, testing right now. In 2021, it was PCR, or you went and got a rapid from Convenient MD, and I would get a report on all of them. Just that's not going to happen anymore. It's good that we have home kits. It's just a little bit different when you look at the case counts. Okay, so take that in. So as far as vaccinations, we gained 151 first, second, and booster doses. So the numbers didn't change that much. It was 20 new people decided to get vaccinated. 42 decided to get their second dose, and 89 people this week decided to get their booster. So those numbers will move slightly up each week because we're so heavily vaccinated. I think people have had plenty of opportunity to decide whether they're going to get vaccinated or not. So, 20 people changed their mind this week. Again, if you see this chart, I show this every week, is the number of cases in fully vaccinated individuals. You see the double asterisks. That's because they've changed the definition of a COVID death. That number has been lowered a little bit. So 0.48, or 0.5%, a little less than 0.5% of COVID-19 cases among vaccinated people has resulted in death. Hospitalization is 1.67%, or 7,000 out of the 456,000 vaccinated people were hospitalized. And then the far right, what that chart means is that all individuals who have been vaccinated, that is, the rate. So 8.6% of all vaccinated people have had breakthrough. Okay, so, and of those, and of all vaccinated people in the state, 0.14% have gone to the hospital. So, again, vaccines work, and Omicron generally didn't cause as much lower respiratory and was less severe. And so, now the case counts are on the low side. So, that's where we are with that. Quickly, vaccine, again, vaxfinder.mass.gov. Plenty of opportunity to get vaccinated. Homebound, again, call the health department. Okay, 508-495-7485. We can get the VNA down to do it. We have not had a call in several weeks for homebound. I guess we've done everybody. It's hard to know who's homebound and not, so just a call. Testing has not changed much. Cape Cod Church is closing. The Cape Cod Church, which is Barnstable County, was originally doing out of the fairgrounds. No one's showing up there. It just doesn't make sense. Community Health Center, believe they still have test kits available. Falmouth Hospital still has that ability. Convenient MD and the pharmacies are still doing it as well. The primary now is home kits, which again will throw off whatever case counts I can give you, but it'll still work fine with hospitalizations and deaths. just because those are much easier numbers to get accurately. Again, face coverings, there's no requirement for face coverings. You do you. So, based on your health status and your comfort zone, you would decide whether you want to wear masks or not in indoor public places. So we don't have any mandates at this point in time. Again, we'd have to rethink it if we went to the high risk, as the CDC has outlined for us. So as a recap, case counts are still at a nice level, at least as far as PCR goes. I think the numbers are actually a little bit higher, but still not a real high number like we saw in January. It's just that we can't capture that. We're in the CDC for the green or the low risk category based on PCR case counts and hospitalizations and the burden on the hospital. There are no mandates or advisories in town. You just consider your individual circumstances and decide whether masks are right for you. If things change, then we'll have to do something, but let's enjoy where we're at now and take it for what it is. If we don't know, if anything we've learned is that there's an ebb and flow to this. There'll be times, I think, where there'll be higher case counts, and there'll be times when there's going to be lower. It'd be nice to have the rest of the spring low like this, or the lowish level, knowing that the last 2 summers were quite low for the most part, and then maybe, if anything pops up, might be in the fall. So, if we can get to enjoy the time that we have with low counts, let's do it. And so that's what I have for an update this week. We'll do another one again next week, and that's it. Thank you.